Oral contraceptives. Oral contraceptive pills (OCP) consist of the hormones progestin and estrogen, or only progestin, and must be taken orally once per day in order to prevent pregnancy. Advantages: it usually makes your bleeds regular, lighter and less painful. It reduces your risk of cancer of the ovaries, womb and colon. It can reduce symptoms of PMS, premenstrual syndrome. Disadvantages: it can cause temporary side effects at first, such as headaches, nausea, breast tenderness and mood swings. It can increase your blood pressure. It does not protect you against sexually transmitted infections. Side effects: nausea, vomiting, stomach cramps or bloating, diarrhea, constipation, gingivitis, increased or decreased appetite, weight gain or weight loss, brown or black skin patches, acne, hair growth in unusual places, bleeding, or spotting between menstrual periods, changes in menstrual flow. Transdermal patch. The transdermal contraceptive patch is a safe and convenient birth control method that works really well if you always use it correctly. You wear the patch on certain parts of your body, and it releases hormones through your skin that prevent pregnancy. Advantages: transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug-drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. Disadvantages: it may be visible and it can cause skin irritation, itching and soreness. It doesn't protect you against STIs, so you may need to use condoms as well. Side effects: rash, redness, eye pain, discomfort, blurred vision, seizure, painful or difficulty urinating, stomach pain, nausea, vomiting, vaginal ring. Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended periods of time. The ring is inserted into the vagina and provides contraception protection. Advantages: benefits other than contraception include regular menstrual cycles, less blood loss with periods, less iron deficiency anemia, less menstrual pain and cramping, reduced risk of ovarian and endometrial cancers, fewer functional ovarian cysts, fewer ectopic pregnancies, and less benign breast diseases. Disadvantages: you may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Side effects: an increase in vaginal discharge, irregular vaginal bleeding, nausea, sore or tender breasts, headaches, bloating, changes to your skin, mood change. Subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid, progestin from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. Advantages. Advantages of progestin implants include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages. A person may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness and mood swings. Also, periods may be irregular or stop altogether. Side effects: nausea, stomach cramping, bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, vaginal irritation, discharge, pain, bruising, numbness, infection. Hormonal injections. The hormonal injection prevents pregnancy by injecting a synthetic version of the hormone's progestogen, called depot, medroxyprogesterone acetate, or DMPA. The injection is also called depot. Depot prevents the body from producing its own hormones and releasing eggs from the ovaries. Advantages. The timing of injections is not based on the monthly bleeding. It works similarly to the pill or the ring, except that you don't have to remember to take it every day or every week. Disadvantages: your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections. It does not protect you against STIs. Side effects: weight gain, headaches, mood swings, breast tenderness, irregular bleeding. Periods may become more irregular, heavier, shorter, lighter, or stop altogether. Intrauterine device: the doctor will put the UD in a small tube that they'll insert into a female's vagina. They'll move the tube up through the cervix and into the uterus. Then they'll push the UD out of the tube and pull the tube out. Strings attached to the UD will hang 1-2 inches into the vagina. Advantages: IUDs give you great long-term protection against pregnancy. They're more than 99% effective. They work as well as sterilization and the birth control implant, pill or ring, or use it incorrectly. Like condoms, IUDs are set it and forget it. Birth control. Disadvantages: these IUDs are expelled without the knowledge of the wearer in about 10 to 15% of the women, and they run the risk of becoming pregnant. There is risk of perforation of uterus and infection. They can cause excess menstrual bleeding and pain. Side effects: headache, acne, breast tenderness, irregular bleeding, which can improve after 6 months of use, mood changes, cramping or pelvic pain. Chemical barriers. Chemical barriers are sperm-killing chemicals inserted deep into the vagina, near the cervix, before sexual intercourse. Advantages: it's convenient and cheap. Chemical barriers: doesn't have hormones. Disadvantages: have minimal protection against STDs, possible vaginal irritation, and allergic reaction may occur. Side effects: cloudy or bloody urine, increased frequency of urination, pain in the bladder or lower abdomen, thick, white, or curd-like vaginal discharge with use of cervical caps or diaphragms only, vaginal irritation, redness, rash, dryness, or whitish discharge. Diaphragm and cervical cup. A diaphragm and cervical cap is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix, the entrance of your womb. You need to use it with a gel that kills spermicide. Advantages: a person or female only need to use a diaphragm or cap when she want to have sexual intercourse with someone. She can put it in at a convenient time before having sex. Use extra spermicide if you have it in for more than 3 hours. Disadvantages: it's not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly, and does not provide reliable protection against STIs. Side effects: from the spermicide, irritation of the vagina, strong odors or vaginal discharge. If the diaphragm or cervical cupus left in too long, a higher risk for urinary tract infections, UTI. Male condoms and female condoms. A condom is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection. Advantages: when used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. Disadvantages: some couples find that using condoms interrupts sex. To get around this, try to make using a condom part of foreplay. Condoms are very strong, but may split or tear if not used properly. If this happens to you, practice putting them on so you get used to using them. Side effects: but latex can trigger an allergy in any of the partners. It may lead to rash, hives, and a runny nose. In severe cases, it can even tighten the airways and decrease blood pressure. If you or your partner is allergic to latex, then you must opt for a polyurethane or lambskin condom. Surgical method: tubal sterilization, also known as tubal ligation or having your tubes tied is a permanent method of contraception that you can choose if you are sure that you do not want to have children in the future. Advantages: more than 99% effective at preventing pregnancy. Blocking the fallopian tubes and removal of the tubes should be effective immediately, but use contraception until your next period and it will not affect your sex drive or interfere with sex. Disadvantages: problems are very rare, but this type of surgery can cause bleeding or damage your bowel, bladder, or major blood vessels. After tubal ligation, you might have a rapid decline in the hormones, estrogen and progesterone. Side effects: side effects from the anesthetic and surgery are possible. Infection, bleeding, and accidental damage to nearby organs such as the bowel or bladder are possible but uncommon side effects. The anesthetic can sometimes cause side effects such as nausea and tiredness. Abstinence. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. Advantages: has no side effects or health risks, prevents pregnancy and the transmission of sexually transmitted diseases. Abstinence may encourage people to build relationships and connect more in ways that don't involve sexual activity. Disadvantages: experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people may find it difficult to maintain abstinence over the long term. Side effects: experiencing aches and pains, increase in blood pressure and stress levels, tightening of the vaginal canal for folks going through menopause, decreased prostate health. Calendar method. Calendar-based methods are various methods of estimating a woman's likelihood of fertility based on a record of the length of previous menstrual cycles. Various methods are known as the Nosogeno method and the rhythm method. Advantages: calendar-based contraceptive methods prevent pregnancy by monitoring the fertile periods during the menstrual cycle. The standard days method can be used by any woman who wishes to prevent pregnancy and experiences regular menstrual cycles between 26-32 days in length. Disadvantages: the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. No side effects. Basal body temperature. The basal body temperature method, a fertility awareness-based method, is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. Advantages: basal body temperature can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Disadvantages: the basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted diseases. No side effects. Cervical mucus method. The cervical mucus method is a type of natural family planning, also called the Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. Advantages: the cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Disadvantages: the cervical mucus method does not protect against Sexually transmitted diseases. Also, several outside factors can change the look and feel of cervical mucus. These changes may make it difficult to evaluate the mucus, to predict ovulation and prevent pregnancy. No side effects. A fertility awareness method, used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. Advantages. The symptothermal method is easy to learn and an effective FAM for attempting to achieve or avoid pregnancy. There are no devices or drugs to use that harm the body or a couple's fertility. Disadvantages. Intercourse must be restricted to only 7-13 days of the cycle. Women must take their temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. No side effects. Ovulation method. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone LH in the urine. A rise in this hormone signals the ovary to release the egg. Advantages. These tests check the levels of this hormone. By detecting a surge in LH, it helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. Disadvantages. Limited detection. Ovulation tests detect LH levels, but they don't give you an exact date of ovulation. Eggs may not emerge even after an LH surge. No side effects. Coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Advantages. Some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risks. Disadvantages. Coitus interruptus does not protect against sexually transmitted diseases (STDs), including human immunodeficiency virus (HIV), and women using this method should be counseled that consistent and correct use of the male latex condom reduces the risk for transmission of HIV and other STDs. No side effects.